Good afternoon, everybody. Great to have you back with us for our webinar series. Today we'll be talking about J cushions and in more particular J seating systems because I'm a big believer in a cushion alone just won't do the trick. So I tend to consider them seating systems and including the backrest. So we'll get right started. When we look at seating systems, independent of what kind of client, what kind of diagnoses we're talking about, we really expect them to do three core things for us. One, of course, we expect them to manage our pressure and to protect the skin more specifically. We also want to enhance postures so that we can sit as good as possible. And that all really is going to lead to a stable base. And from that stable, good posture, obviously we have more functional abilities. We're able to participate in life. No matter whether we're talking about a pediatric person sitting in a pretty dependent chair, or a client with muscular dystrophy, or a fully active client pushing a manual wheelchair. Our seating systems, independent of what type of mobility base they're using, need to do these three key things for us. All of those, again, are going to bring us to our ultimate goals of promoting better function, being able to do more things, get back out to life, and being comfortable while being in that seating system. And again, comfort is going to be inclusive of absence of pain and just being comfortable and restful in that posture. We know that skin protection is one of the key tenets to our clinical practice. But what I want to also consider is that posture is intricately linked to skin protection. It's really difficult to have healthy, protected skin free from pressure injuries without good posture. Obviously, pressure distribution is going to help us with keeping the skin healthy. And our surface selection is going to help us distribute pressure and influence our posture. And then there's that other part of the puzzle is the microclimate at the seating interface. So what kind of humidity, what kind of temperature, what kind of sweating, moisture is in that surface, both at the cushion interface and at the backrest interface. So these four components really help us to protect the skin. We know that the ultimate protection is really moving. So I couldn't leave the slide without making sure that we all know that making position changing, weight shifting is a key tenet to skin protection as well. We're going to start with posture here because, again, that's just a key tenet to skin protection and management of healthy skin. And we look at postural support. We all know that the pelvis is the key here, right? We start with the stable base, and we're going to look to that pelvis because we're a biomechanical chain, and influences that we do to the pelvis are going to influence up the biomechanical chain and across the biomechanical chain. Also remember, we have to consider all three planes of movement at each of those joint interfaces. So at the pelvis, again, where we're going to start, we'll need to look at the frontal plane. We'll need to look at the sagittal plane and also that rotational transverse plane. Once we're done looking at the pelvis, we'll move to the spine, lumbar, thoracic, cervical, and then the influences that the limbs, both upper and lower, have on those central columns. Postural support, remember to have a good posture and support that, we have to respect their available range of motion. We'll look at the hip joint in terms of flexion extension, abduction, adduction, internal, external rotation. The spine, again in those same planes. The knee joint. We want to have this be a functional posture that's, obviously that they can get into that posture, but also that they can sustain it, that they can maintain that posture for the length of time that we anticipate they're going to need to be able to sit. That posture is going to be produced, supported by, firstly, the contours in the seating system. And that's what we'll be talking about at today's webinar. And then we can also manipulate the angles of both the seating system, say the backrest, and also the wheelchair angles. So both this combination of contours and angles can promote the posture that we want to see in our clients. Remember that we're going to consider the 3 planes of movement across each of those bony segments or those bony areas of the body, how they influence one another. So obviously we have a poorly supported posture here, but after we look at his available range of motion, hips, knees, ankles, his spine, his head position, we think about what we might support in terms of contours of a seating system, seat cushion, back cushion, headrest, and then we can look at the angles and we can support a much improved posture. Here we've looked at what ranges of motion were available to him. He has some asymmetries in pelvic rotation and pelvic obliquity, so we've accommodated for those, but then supported in that posture so that any of those asymmetries don't worsen over time. What we'll talk about today is using the contours in that seating systems, cushions and backrests, in order to establish a really great posture. So in the sagittal plane is going to be your anterior posterior motions. So for our little skeleton man here, again, we're going to start at the platform for function, which is the base here, the pelvis. So if we want to make alterations in the sagittal plane, it'll be posterior to anterior sort of forces, starting at the primary source and then moving up that biomechanical chain. So asymmetries that we consider in the sagittal plane most commonly are your posterior pelvic tilts, perhaps your anterior pelvic tilt, your kyphoses, your forward head, and just your generally collapsed postures. Your frontal plane asymmetries, now these are more of your pelvic obliquities and your scolioses. Now our forces are more typically lateral, coming from outside or lateral to medial, influencing those postures, either holding them in place so they don't get worse or altering them, reducing those asymmetries. Our transverse plane asymmetries are your rotations. Here we have our pelvic rotations, and then you can imagine as the spine, we'll have rotations at that spinal column as well, creating rib humps and rotations up that biomechanical chain. These are going to be both anterior posterior forces to reduce those, as well as maybe some lateral forces. So whether we're trying to reduce those asymmetries or just hold them to maintain them, we're going to use probably our control, our contacts, 3 points of control to manage these asymmetries. What we've learned over time is that we really want to affect the apex or the most curved portion of the primary curve. We're going to give that some support. We're going to contact with either a contour of the backrest or a lateral thoracic support. And then it'll need some opposing forces to manage those forces and to either maintain the posture or correct it. And our most successful locations are going to be on the opposite side above the apex of that curve and also below. That way we have 3 points of control and we're able to manage, create those points of contact, which is manageable in terms of comfort level and also pressure management. Remember, when you're adding those 3 points of control, that you have to be in the plane of movement that you're trying to affect, either by maintaining it or correcting it. Know that we have to manage the pressure, the comfort level of those 3 points or any point of control that we're utilizing. So let's look at those 3 planes of movement again. So for our sagittal plane Here we have a posterior pelvic tilt, we have a thoracic kyphosis. Even though we want to look at this big curve here, it's not the primary curve. That is a symptom of the foundation being in the posterior pelvic tilt. So remember, one of the rules is that we want to affect the apex of the primary curve, the starter one. So your force is going to be a posterior to anterior one at sort of the PSIS level of the pelvis, and that motion is going to either hold that pelvic tilt if it's fixed, or it's going to reduce it. But then you need your helper forces, your opposing forces. Easiest place is to put a contour into your cushion so that we can have the opposing force from front to back, from anterior to posterior. And then we have another location, that second higher opposing force. Again, it will be an anterior to posterior force, allowing that pelvis, 3 points of control, to come into that neutral position, or in the fixed case, to hold it there. This is obviously going to be a support from your backrest. This is going to be contouring different foam selection in your cushion, and then this is most likely going to be an anterior pelvic support. After you've managed the pelvis, you'll then move up the biomechanical chain using the exact same strategies. We'll have a posterior to anterior force at the thoracic spine. And again, realize that once you move this pelvis, this curve is going to change. So wait until you've affected the pelvis and then look at where the new apex of the curve is. Add a force there, and then you'll have this force being the opposing force below, and this force being the opposing force above. These posterior to anterior forces are your backrest. Here's your cushion. Here's your anterior pelvic belt. And hopefully this is gravity. Or you could use an anterior harness to help support that. Remember, gravity is a force that we should be utilizing. If we look now in the frontal plane, these are your obliquities, your scolioses. So, but again, the idea is the same. Start at the pelvis. Now this obliquity here needs a inferior superior sort of force to alter that. So now your force, depending on how much movement you have in the pelvis, you're going to have a force here to manage the pelvis or to distribute pressure if that's a fixed pelvic obliquity. And then you'll get into your 3 points of control for the lateral curves, the frontal plane issues. Remember that we have to deal with that pelvis before we look at the scoliosis, because that pelvis is going to really affect those bones on top of it. Because you can see from those slides we went through that a lot of this postural control actually starts from the backrest. That's where we're going to start with the J line. The backrest is integral to the postural support of a client, and that posture is integral to their skin health and skin protection. The J3 backrest is a portfolio, whole family of different backrests. I'm sure lots of you have seen it before. It's an aluminum shell that mounts with hardware onto back canes of whatever chair you're using. Has a soft foam with an anti-shear stretchy cover over the top. Now comes in 5 support contours, from minimal sort of contour for a person that has pretty good trunk control to a maximal total hug control. We'll go through each of those contours. It also comes from something as short as 6.5 inches tall all the way up to 26 inches tall. You're going to choose that support contour and the back height depending on how much trunk control your client has and where you want those forces, the posterior to anterior force and the lateral forces, to affect the posture that you're trying to create. If you're doing a less contoured version, you would have the option of adding additional swing away lateral trunk supports. And obviously there are headrests and anterior trunk supports available to further improve that posture. A little plug for the Education in Motion website. Please visit that. We'll show you a link to that a little bit later. But we're starting to deposit lots of assessment tools, clinical guidelines, best practice advice, blogs, user stories, and measurement charts. We've redone this measurement chart so that it's more up to date with the latest research and documentation that we know. Basically, this form is going to allow us to get good measurements to share with our dealer support, and also to help us choose, in this case, the J3 back that's going to do the trick for us. So this measurement chart, we could fill in all of these live and then send it off to the dealer to help us try and figure out which J3 back we want to trial with our client. For J3 back, first we want to measure the chest width that the client needs. Make sure that you're measuring the client in the posture that you're trying to create, that they're going to be likely to sit in. If they have a scoliosis, figure out, first of all, if you can manage the pelvis and affect that scoliosis, and then use your lateral supports, those lateral to medial supports, to either hold that scoliosis or affect it so we can be more midline. And then you're going to measure their trunk at the widest location. You may need to add some width if we have other secondary supports being added, or realize that some of these contours actually take up space, and so we need to make sure that their chest width will fit in between those lateral contours of the back support. We also want to know their overall shoulder width, and for this you're going to measure from their acromion to their acromion. Again, we're measuring for their typical seated posture, the posture that you're trying to affect. So consider whether that scoliosis that you see is fixed or flexible. We'll also use this acromion to acromion measurement to make sure that we can mount any sort of anterior straps that we're going to use for that anterior support. The client's trunk depth will help determine which sort of contour that we want to use with the client. If they need full trunk support, you'll want to have a deeper lateral there to support them. If they have a rotation in that transverse plane, you might want to have those laterals come further out on one side than the other. Make sure again that you are looking at whether those postures are fixed or flexible, how you can reduce them. And then the last measurement we'll need to take is the overall height of the client. Here we might want to look at 3 different measurements. If they're in a tilt-in-space chair, or they need full support, or you're using anterior chest harness, you'll want to get a measurement from the seat surface to their top of the shoulders. Because each of those scenarios I brought up will need to have the back support being fully up to their shoulder height. For somebody that's more active and has better trunk control, maybe measure from their seat surface to the inferior angle of the scapula. We know that that shoulder joint works better when I have freedom for the shoulder blade to move around the chest wall. So this will allow that scapula to move during propulsion. It's also good practice to measure from the seat surface to the axilla or to the armpit. That way you have a good height as to where the laterals can't go any higher. So we want to make sure that there's space underneath that axilla. Their actual back support that you choose is going to be dependent on how much support they need, how much trunk control and trunk balance they need. So in practice, what we'll do is we'll put our hands on and figure out where they get the best support and where that back height needs to end in order for them to have a functional posture. The J3 back, I told you, is a whole family of backrests. So therefore, we've created a little guide so that you can order the appropriate one and know what those codes stand for. So these little snapshots that I've taken in the next couple slides are from this J3 back ordering guide. It's a great reference. It walks you step by step how to choose the height, the contour, the components, the size, and then come up with a code that you can use to order the backrest. So obviously the first step is figuring out what type of contour, what sort of shaping you want for this backrest. The J3 family comes in 5 different shapes. You can see here we've named them. The more flat backrest that you'll use for clients that have good trunk control, don't have a lot of rotational asymmetries or scolioses, or perhaps you want to use swing away laterals to give them their side support, you might utilize a posterior type of J3 backrest when we label this a PA backrest. If you need just a little bit of a lateral wraparound hug, this is a posterior lateral backrest. This has almost an inch more lateral contour when we compare it to the posterior backrest. And then we make 3 different backrests that have a 6-inch depth contour. We vary where we put that contour to meet clients' needs. We'll start with the middle one here, posterior deep lateral. That contour is right at the middle of the thoracic spine. I tend to use this for clients that have poor trunk control. They tip over to the side without side support, but they have a pretty symmetric posture. So if I support it, they can come to midline and stay in midline. I tend to use the posterior deep contour for someone where I want to give them support more at their hips. Let's say they just tend to rotate away or slide away from the back support a little bit. That'll give me the hug at their pelvis. If I also need to control their upper trunk, I can add lateral thoracic supports into the slots here, much higher on their thoracic spine. This is a really nice backrest for somebody that needs lots of trunk control. They tend to tip over to the side and get a scoliosis. So this bottom contour can manage their hips, and then I can offer higher up trunk support via lateral swingaways. Because the lateral swingaways on this backrest will be, they can be adjusted in terms of location. I could have them for asymmetry such as a scoliosis, if I needed to be more inset than on one side versus the other, or if I needed one higher on one side versus the other. So with this PDC backrest, I could manage more fixed scoliosis or fixed sagittal plane asymmetries. Going back to the posterior deep, this is the newest version in our line. You can see I've basically moved that deep contour up from the bottom of the backrest, about 3 inches. This is perfect for your pear-shaped ladies. You need some more space for their hips, but you need a full trunk support. They tip over without that side support. They're able to get symmetric, but they need a lateral hug, but they also just need a little bit more space for their hips. Again, that posterior, called a PA, has just over 2 inches of the lateral contouring. You can see here that I can move the hardware up and down. I also have 2 inches of width adjustability within all the bracketry. So I can go onto a 2-inch wider chair than the back is ordered. And it has built-in slots for the laterals. It also has built-in locations for your anterior harness. Posterior lateral, we're just bringing in that contour a little bit on the side. Hardware, same adjustability. Lateral, same adjustability. Sometimes I'll use this backrest if I'm a little bit skinny for the J3, and then that lateral contour just wraps around, makes it a little bit skinnier for them. Or if you just need a little bit of a lateral hug, but not more than 3 inches. And then again, pictures of those the deep contour shapes. posterior deep lateral, where the lateral support comes at the trunk region, at the hip region on the PDC, and then the PD version right in between those two others. The hardware, more difficult to see on this image, but it has the same adjustability. I do have that lateral slot, so I could add thoracic laterals. Here, I do not have that ability. I'm going to have a symmetric trunk position if I'm using this PDL backrest. Step 1, choose the contour. Step 2, choose the support height. So we make these backs, as I said before, in as short as 6.5 and up to a full shoulder height backrest. We name them by the regions of the spine that they're contacting: lower thoracic, mid-thoracic, upper thoracic, and shoulder height. But then each of those support heights can also come in a short, medium, or a tall version. So basically what that means is that we have a backrest every 1.5 inches. So it'll be a short lower thoracic version, 6.5 or 8 or 9.5. And then the same thing goes with the mid-thoracic, upper thoracic, and shoulder heights. Your job is to figure out what shape they want and what height of a back surface will best suit both their functional, practical needs and their postural support needs. And then the backrest width that's required. Remember how we talked about how the backrest can fit on different width chairs? A certain size back width, say a 16, can adjust to go on a 16 or 17 or 18-inch chair. But we do also have to consider that the client will fit inside the contour. With these more flat backs, you have nearly the full support width available because there's just not a hug. We're not taking up space in that hug. But if we look at the deep contour versions, an 18-inch backrest will fit on an 18, 19, or 20-inch wide chair, but the client's chest width should be 3 to maybe 3.5 inches narrower because, again, that contour taking up space in the backrest. So that's an important consideration if you're doing these deep contour versions, making sure that the chest width of your client suits. Step 5, we're going to select the hardware that makes the most sense. We offer a standard version, a TH, which is called the tilt hardware, a reduced hardware, reduced in terms of weight. We're going to use this on our more active chairs. And then we also do a 4-point hardware that will give 2 mounting locations on either side. Let me go to one picture that's a little bit clearer so you can see what these look like. I'll start with the standard hardware, which is in this picture here. You have one mounting bracket that will go on either side, either back cane. It clamps on to any size tubing. So if you have thick tubing or skinny tubing, it'll clamp on. And then the standard hardware has a pin that will drop down into that receiver and lock this into place. Here you can see you have your width adjustment. You can also see in this picture that you have your depth adjustment. That's also going to give you back angle adjustment. So if you tilt the top up a little bit, that bracketry will allow you to put a nice 10-15 degrees of back angle adjustment into that backrest. That's sort of a position that's more relaxing. Client might have better head control in that position. The standard hardware has a 136 kilo weight capacity. It's available on our all of our backrests, actually, except for the heavy duty. It's quick release. They push those little toggles forward and the back releases so you can fold the chair easy. And then to re-engage it into that hardware, it just drops into those receivers, clicks into place. This is transport approved, so you can travel in your crash-tested wheelchair with this J3 backrest. If you look to the picture to the right, this is the reduced hardware. We lose weight and we lose about an inch of height to the backrest. Still have all the same adjustability, yeah, but we're just reducing the weight, reducing the amount of back cane that you need to mount that backrest. You're probably going to use this on your carbon backrest, on your lower thoracic backrest, when weight is a really important consideration, but you still need the thing to remove for transport. This picture here on the left is our 4-point hardware. It's called FS in terms of part ordering. And instead of having one mounting location on either side, you now have two. So the top portion is very similar, but now we've extended that bracket in a pin that will go into a U-shaped receiver. This is the hardware that you want to use for your heavy duty, your bangers, your movers, people that you just need 4 points of attachment for that J3. It still removes, but it's a little bit trickier. So I recommend using this for backrests that don't need to be removed every day. Perhaps a power chair, a tilt in space, where you've got people with more spasticity, more movement, or just heavier in general. This last one is probably my favorite hardware. It's the TH, tilt hardware. And we named it that because we imagine you might use it on our tilt in space, like our Iris chair. Very similar to the standard hardware, except now our mounting bracket here is almost 1.5 times as long as the standard. We've also made the pin longer, deeper, and tapered, so that this system is going to work in our heavier duty capacities. This has our heavy duty weight capacity, but still is easy to get on and off if they need to remove that backrest. This is the TH hardware. And then you have lots of options and accessories that you can add. If you need to do with transverse plane, rotational asymmetries, either fixed or flexible, you might use some of our inserts, because this is going to change the depth, the contour of that backrest. If you have a pelvic rotation, you can add some little lateral pelvic shims, or you could add wedges to take up the space on the rotated forward side. If you have a flexible rotation, put those wedges on the other side to de-rotate. If you have a lazy sacrum, a lazy pelvis, you could add some little bean bags at the top of their sacrum, give them a little bit of sacral support. These are a softer approach. Want a bit more of an aggressive approach, you could use a little block wedge. So these spine aligned pieces are going to help you create the contour to match the posture, the trunk posture that you have, so that you can increase that surface area distribution and also give that point of contact to try and influence the posture you're creating. You can get all these pieces individually, or they are available as kits. Don't forget, we make a nice little vanity flap. If you've got a client that their drawers come down, just a little bit of space here, you want to give them a little bit better look there, just fabric and velcros to the back shell and then onto the seat upholstery. Keeps their cushion in place, keeps them covered in the back. In that J3 family, we also offer a carbon backrest. This is a fully carbon shell. Basically, what that carbon J3 is going to do is reduce the weight of it and increase the strength. If you do a lumbar thoracic sort of backrest, 8 inches tall, it will be round about the exact same weight as an upholstery, offering much more back support, postural control, more comfort, better ergonomics, and not influencing the overall weight of their chair. easily removable because it's got those locking pins, and off the backrest goes if you need to fold the chair. We also make the J3 in the HV, the heating and ventilation version. In that version, we carve out a bit of the back foam and we put in heating coils and little micro fans. The little heating coils will produce a nice warm sensation so that the body has a little bit of warmth. If they're cold, they can't regulate their body temperature. Colder locations in the winter, that's a fabulous thing to have. The cooling is a ventilation system. You can see the shell is different than our normal shells, has little ventilation outtakes here, and so it draws in the cool air from outside the surface, and the mini fans will blow that colder air onto the client, decreasing moisture, decreasing heat, creating a better microclimate, creating a more comfortable client. So the backrest gives you both the heating and the ventilation in the one system. Has a little lithium battery that goes in the pouch here. The heating lasts about 6 hours on one charge. The ventilation has 6 hours, a little bit less than the heating, which will last about 8 hours. The lithium battery is fully rechargeable, plugs in like a cell phone. Okay. Really nice option for maybe spinal clients that just can't maintain their body temperature, and a little bit of heat behind them feels fantastic. The ventilation I've seen quite successful with your MS clients. We know their symptoms are worsened by heat, and also any of your really spastic, athetoid, ataxic clients are expending so much energy. They're hot, they're sweaty. Just having a little bit of that ventilation has helped them become or maintain comfort and decrease any wetness, sweating that happens. So we've looked at the posture that we can create through the J3. Now we're going to look at those 3 other components of skin protection: the pressure distribution, surface selection, meaning what kind of materials we're going to put in this cushion, and that seating surface microclimate. Can we manage that at all? And again, this is going to be independent of what type of chair, how active they are, how able they are. We're going to use the same strategies. Couldn't help but adding just the primary risk factors for pressure injuries. Your 2 primary risk factors are the history of a pressure injury. We know that skin is never as healthy as it once was. Make sure you're asking, have they ever had a pressure injury on their seated surface? And then your next your primary risk factor is their inability to change their position, to alter their pressure, because they can't do it, because they don't remember, because they won't do it. Okay, so those have to be really considered in terms of their primary or their big risk factors. Next is the amount of time that they spend sitting in the chair. More time, just increase their risk. Abnormal sensation, because they're not getting the triggers to move. Asymmetric postures, because they don't have equal weight bearing, because they're weight bearing on pressure intolerant areas. And then incontinence. We know that wet tissue is not healthy tissue. We know that urine breaks down skin tissue. We want that skin surface to be nice and dry, free from moisture, free from humidity. Please also consider the important secondary risk factors like poor nutrition, poor food intake, poor protein, poor albumin. Already talked about incontinence. Muscle atrophy. You just don't have that muscle belly protection of your bony prominences after those muscles atrophy. The older our skin gets, the less self-protective it is. We've spoken about the seating surface. Think about the other diseases that might impair their circulation: diabetes, cardiovascular, respiratory diseases, anything that's going to impair their ability to store oxygen or to move oxygen around the body. Decreased cognition, mostly because they forget to move, they forget to do their pressure reliefs. And then smoking, because smoking is really a big factor in oxygen carrying capacity. We know that we have two major strategies in our cushion materials for protecting the skin. The first is immersion envelopment, where we're using a different type of material, and basically that material is conforming to the person's body shape, increasing pressure distribution. If I'm increasing the surface area distribution, I'm decreasing the pressures. Our other strategy is offloading. We're taking the pressure off of places that are at risk, such as the ischial tuberosities, the sacrum, the coccyx, and we're loading it onto areas that can tolerate that pressure, like your leg bones. Because they're long, they've got good surface, there's no pokey bony bits. And we can load those greater trochanters for the same reason. They're good, they have good muscle belly protection so that we can support via the pelvis, the femur, and take that pressure off of the other places that are at risk. Difference between immersion and envelopment. Immersion means I'm sinking in. Envelopment means it's filling in all those nooks and crevices. Basically, we need immersion and envelopment to really decrease the pressure. Pressure is really affected by the surface area in which it's distributed. In terms of the load to offload, schematic here of how the J-Well technology works, independent of the cushion, but basically we're going to load up that GT, the femur, because they're long surface with long bones, no bony bits. We can load that to offload the things that we know are at risk, the sacrum, the coccyx, the ischial tuberosity. And for our more at-risk clients, we're going to offload into a fluid material. But we'll talk about all that when we get to the cushions. Two other definitions I think that are worth going over quickly. Remember that friction is when two forces are moving together. We don't want a lot of friction, obviously, in our cushions, but some friction is okay. Friction at the thighs means that it's going to be less slippery and we're going to have less movement. It's the shear that gets us in trouble. Shear is when one part is moving on another. In this regard, the skin, the soft tissue are sliding on a surface, the cushion, that's not sliding. Basically what that does is it deforms the tissue, the skin, the soft tissue underneath, and then that can cause a lack of blood flow, leading to the ischemia and the breakdown. So shear is really what we're trying to prevent. Again, shear management is going to have a lot to do with posture management, which is going to lead us to cushion contours. We need to have that anterior to posterior force in our cushion. We talked about this with our posterior pelvic tilt. My primary corrective or hold force is going to be the backrest from posterior to anterior, but then I need that opposing force here, keeping the pelvis back. Easiest place to do that is with some sort of ischial shelf. And that ischial shelf can be a different density of foam between the two. Or in our more at-risk clients, it can be a fluid in this rear section and then a denser foam material in this section. However, whatever material we choose, we want to create that ischial shelf so that we can hold that pelvis into place. I'm not going to go over microclimate a lot today. We have some exciting new developments happening in this space. I'll tell you about those in the months coming up. But that microclimate, that seating surface microclimate, we're trying to affect temperature and moisture. So we know that these are risk factors for pressure injuries. Prolonged moisture can lead to maceration of the tissue and help it break down. Right now, we're sort of limited to cushion covers to influence that microclimate, or with the J3 heating and ventilation backrest, we could maybe use those fans, but more coming in this space, so stay tuned. You should have, when you downloaded the webinar, you should have downloaded this brochure. This is where all the technical information is on the cushions. So I'll refer you to look at that after we go through the rest of the webinar. It gives all the sizes that are available, the weight capacities, the height, the dimensions, things that are useful if you're trying to select a cushion. And we're going to take the portfolio from least to most, if you will. We'll start with our simple basic cushions that you'll use for clients that are sitting short term. They do a nice pressure relief. They have minimal pressure relief needs. And then we'll build up to our full complex clients. Our basic cushion is a 2-inch foam cushion. It comes in a basic and a pro. The pro has little side build up, so it's got a little bit more contouring. It's standard pressed foam, but we protect that foam by an incontinent cover. You're going to use the basic cushion for clients that are sitting just a couple hours a day. They can change position, they can shift, they're still ambulating. Basically, they're just in a wheelchair for transport or maybe for doctor's appointments, and you need a nice comfort cushion over the top. We have added a Waterlow scale, because I know a lot of you will use this in your clinical practice. We shouldn't see a Waterlow scale higher than 8 if we're expecting to use the basic cushion or the basic pro. That's what it looks like, a little bit of the contouring. Incontinent stretch cover over the top. The Softcom BP is our 2-inch dense foam, but then it has both a denser foam and a softer foam over the top. It has mild contouring. The difference in this cushion, however, is that we expect the person to use it for a longer period of time. We actually coat the base itself with an incontinent proof coating. So not only are we protecting the cushion with the incontinent cover, which comes standard, but we're also protecting the foam base. I tend to use this cushion again for just somebody that needs a comfort cushion. They're using their chair for 2 hours, maybe 3 hours at a time. They don't need a lot of posture management. They don't need any pressure management really, except for comfort. But I anticipate that they're going to use this for 5 years. You just want it to last longer than that blow molded cushion that I showed with the basic. Maybe they've had a hip replacement, maybe they've had a knee replacement. You know they're going to be a part-time wheelchair user for a while. So this will be, although it's more expensive in the beginning, it'll last longer than the basic cushion. The J Light is our lightest cushion, hence the name, and it's really our most breathable cushion. Somebody use this maybe with a spinal cord injury. He needs a fair bit of, she needs a fair bit of postural support. As you can see here, we have a well, but instead of any sort of fluid in here, we have a foam, and then it's covered in a Dartex material. So it has a significant greater trochanter femur loading area, a significant ischial shelf, and then just foam in the pressure reduction well area. So this is going to be somebody that needs a fair bit of postural support, but their skin is good. They've never had a breakdown. They do a great pressure relief. They want a super light and super breathable cushion. We use a very special cover on the top of this. It's our Air Exchange. It's sort of like a mattress cover that's padded. And within those special fibers, there's a lot of air flow that can happen. So we find that this is great for somebody that's hot, they sweat a lot, and we want to manage that surface area that in between the client here. So maybe try the J Light if you have a spinal client dealing with heat, moisture issues, and they need a postural cushion, but not an extensive pressure relieving cushion. This thing weighs about 800 grams. It's one of the lightest cushions on the market. The J Ion, we give a Waterlow score of under 15. This one we're using multi-layered foams. So it's still in that low to moderate pressure relief category and low to moderate positioning category, posture category. But we layer the foams so that we can start to create that typical J-well sort of approach. You can see this dark foam here is where my GTs are going to load. So that's creating an ischial shelf, a load up to offload into that well. We're still not using fluid back here, so we're going to be in the lower risk category. But seeing that real typical J approach, let's load up the GTs, the femurs, have an ischial shelf, and then offload to some extent the ischial tubes, the sacrum, the coccyx. This is all open cell foam. Told you it's got a dense foam here for the GTs, and then a more moldable foam here, and then a layer of soft memory foam over the top. Because this is all foam, we want to protect it from sweating, incontinence, has a completely stretchable inner cover. Even the seams don't let urine through, a waterproof zipper. And then our anti-shear wicking antimicrobial cover over the top, creating a really nice cushion. This is a super soft, beautiful cushion to sit on in your low moderate skin protection posture needs. The zip is very similar, it's just for kids. So now, because kids are a bit messier, comes with two outer covers. We've gotten rid of that dense foam here, kids are lighter. Overall, the foam is less dense as well because we have a lower weight capacity on the zip. We can do fun color bands, match their wheelchair frame. But it's the same strategy with that molded and layered foam approach. Zip is for the kids, Ion is for the adults. The X2 is our active, good posture, but significant skin risk cushion. It's got a molded foam base. I'll show you a picture here. Molded foam base with the beginnings of our real traditional well. This is that open cell foam again, so we're going to cover it in a incontinent inner cover. And then we have a fluid bladder. It's about 2 inches of immersion into that fluid. All the fluid that we use in each of these cushions is the same. What differentiates the cushions is the position, the placement of that fluid, and the volume of it. So this X2 would be sort of our mid-range. It has 2 inches of immersion envelopment into that fluid bladder, and then cover over the top, either an air exchange, an incontinent, or a low shear cover. I like this cushion a lot for my active clients where weight and overall height of the cushion is important to them. Maybe they've got an active manual chair and they just don't want to add a lot of seat height, but you want to have some skin protection via fluid and some postural stability. It's a great cushion to try. The J-Easy is very similar. The difference here is twofold. First is that we put this bladder into the cover of the cushion. Think of it a little bit like a kangaroo. We're just managing where that fluid can go. By keeping it in a pocket, it keeps it right in the area that we want it. Ischial tuberosity, sacrum, coccyx, giving them really good immersion into that fluid. You'll see also that the base is a little bit more molded so that we can provide some leg contouring. J-Union, let me flip to the picture here. It's one of my favorite cushions in the elderly, the geriatric market, or even sort of your neurologic, maybe even MS population. Let me show you what we're looking at here. It's got a very similar base to what we saw in the X2 and the J-Easy. It's a molded, denser foam base. And then we've got high resiliency foam here, and then a couple layers of memory foam. But then the tricky bit is that we have a fluid bladder underneath. So it's got a full well, it's got that 2-inch bladder in there, but then it's covered with some really beautiful, very soft foam. I do call this my Princess and the Pea cushion. If you remember that fairy tale, people that sit on this cushion love it. They're happy, they're comfortable. It's also zero fuss. Because we have that fluid bladder underneath the foams, nobody has to move it around. It doesn't come out of location. They don't feel any bumps and whatever. It's just a beautiful cushion to sit on while giving us moderate to high moderate skin protection and positioning, postural control. We've also changed this cushion along the way and added, again, an influence to the seat surface. We're trying to keep that seat surface cool, change the microclimate. In this, we're using cooling gel. So when you actually sit onto this cushion, that surface doesn't get as hot as a typical foam cushion. We just impregnated that foam with some, like that cooling gel that you put on your arm when you hurt it, just to keep that surface as cool as possible. And that's the J Union cushion. And then, of course, let me go back. We have the incontinent cover that's going to go over the top to protect all those foams. And then your outer cover, antimicrobial, anti-shear, so and we sink into that, so it's multiple-way stretch, so it can sink into the materials below it. That's the J Union. Don't forget that we make this in 2 versions as well. We make it in the standard version, which is about 3.5 inches tall. Might be tricky on your more standard chairs, standard height armrests. Or we'll also make it in a reduced profile, which will drop the whole cushion height by 1 inch. If you can see in this bottom picture, our J Your Way division just reduces the height by that seam right there. So we lose a whole inch of height to the cushion. I find that the pressure management is the same. It is a little bit more of a bendy cushion. So if you have really slung upholstery, you may want to add a solid seat insert. J3 cushion. This is our aggressive positioning cushion. I tend to use this with someone that I really want to influence a good posture, and they can sustain a very neutral posture. I say that because this is one of our shorter wells here. So we are aggressively controlling posture. It's also a moderate to high moderate pressure relieving cushion. Within the well, you have options. This is where we're starting to either use our J Fluid or Rojo cells. These are 3-inch high, so right in between a regular profile and a high profile Rojo. And utilizing cells for ischial sort of envelopment, and then larger cells here so we can even out that pressure distribution. Okay, we can either have that be a single valve or a dual valve. The J3 cushion is also one of our more customizable cushions, where you choose the height of the cushion, obviously the size of the cushion, but you can also choose the well size. So if you have a more bariatric client, but you know their pelvis size isn't that much bigger, you could do a smaller well size like we've done here. This is an insert, making it a B size well, and have a much wider cushion. So think of your J3 as your highly aggressive positioning cushion. You have to have good posture to use this cushion. Moderate, high, pressure relieving, and customizable for that well size. The JGS is our pediatric cushion. This is the J cushion that we're going to use with our pediatric guys that we imagine are going to change and grow. Very similar to what we'll talk about with the J2 cushion, has now a closed cell foam here and a base that has an established well and then a fluid bladder that's going to go over the entirety of that base. With the JGS cushion, we segment that bladder into little rectangles. There's 3 on either side. We realize kids aren't quite as heavy as adults, so we don't need that full bladder for them to immerse in. And it also manages the fluid so that it stays better underneath the pelvis. The GS also grows. As you can see, we have these anterior wall reducers so that we can grow that cushion as the child grows. We're thinking this cushion is going to be most useful for the CP population. Those kids tend to grow in height versus in width. So we make this cushion 3 inches longer than it is wide. So for example, a 12-inch wide cushion would be 15 inches deep. Use it in maybe a 12 by 12 orientation, and then as they grow taller, you can just slide that cushion forward on their wheelchair, add these little anterior wall reducers, and you've got a cushion that suits their height. You can also add our positioning pieces to manage pelvic rotations, thigh abduction, thigh adduction, or just to create some contouring so those legs stay in place. So that JGS is a highly pressure relieving, highly positioning, but growable cushion. And there's some schematics about how you change or alter the depth of that cushion to meet the new height, the new length required. Here's what the base looks like without the positioning pieces, and then you can order the pieces individually or as a full component in either 2-inch high or 3-inch high. And then of course the cover has a low shear, full zipper on cover. You can also get that cover in incontinent. The J2 cushion uses a similar approach, but now we're in an adult version. We don't anticipate quite as much depth or height growth, so we don't build that depth growth into the cushion. Has the closed cell base and then a fluid bladder in the back. Now we have 3 inches of immersion into the fluid. It envelops, they immerse into that system, increasing their pressure distribution, decreasing their overall peak pressures. Instead of having fluid in the front of this bladder, we now put foam in there. Foam is going to be softer for one thing and be more comfortable, but it also creates just a little bit of friction, if you will, a little bit of stickum, so that we're enhancing the posture of the client. This is really embedded in the J theory of skin protection. We're going to create the base to provide the postural control, load up the greater trochanters, load up the femurs. Don't slide forward because we have a substantial ischial shelf. And then we're going to protect the areas at risk with the fluid in the back portion, immersion envelopment to those ischial tuberosities, sacrum, and the coccyx. You choose the cushion cover over the top, low shear, air exchange, if you want a little bit of moisture management, or incontinent. You can add all sorts of secondary components like we could with the GS cushion. We can also make lots of base modifications. We can trough out the base if we want the legs to sit a little bit lower, or if we have a stump that we just want to protect. If we have a leg length discrepancy, we can order the cushion for the long side and cut it back on the short side. This one also has that leg trough. We can do a back cane cut, so it can sneak underneath the backrest. We can even do a rail cut if our seat height is a little bit too high in our wheelchair. We could do a little bit of a rail cut and let the cushion sit a little bit inside the frame. All those modifications can be done to the base because it's a closed cell foam. No need to protect it after the fact. The J Fusion is probably our best overall cushion in terms of skin protection and posture management in a super comfortable package. Waterlow scale, we're looking at somebody that's 25 plus. If we look at the Fusion, what we've done is we're using a soft, like the J2 base on the bottom, and then a soft foam over the top. That gives it much more soft feel when the client is sitting on it. It also takes that ischial shelf and makes it a much softer approach, because if they end up sliding forward at the end of the day, or they don't get put in the chair correctly. That foam here is really much softer because it's a soft, slow memory foam in comparison to the dense closed cell foam. Again, because it's that soft foam, we cover it with our incontinent cover. And you also have either the fluid, the J fluid option back here, or you can use your RoHo cells. The biggest difference here is probably going to be patient preference. Maybe they've been using a RoHo for a long time and they really don't want to get rid of their air because they think it's protecting their skin. But boy, wouldn't you like to have a protective and posture helping base. So you can put their air cells on your posture base here from the J Fusion. Or if it's tricky for people to maintain the air, just worried that it's going to go flat or somebody's going to put too much air in it, nobody's going to look at it, maybe then go with the J fluid. J fluid requires less maintenance. They're both going to offer the same skin protection, just a matter of which maintenance they might do better at. Obviously, the air cells are going to be a little bit lighter than the fluid cells. The J2 Deep Contour Cushion, this is going to be our most skin protection cushion, but it's going to give a little bit. It's more forgiving in terms of its posture. I tend to use this for clients, maybe head injured, severe strokes, somebody that I'm much more concerned just to protect their skin than having them with perfect posture. Basically, it's utilizing the same approach as a J2 cushion, just more. I have greater trochanteric loading, I have femoral loading, and then I have 3.5 inches now of fluid immersion into this base. I just think of those ischial tuberosities just swimming around in fluid, being protected. The reason I say it's a little bit more forgiving on our posture is because that well is deeper and bigger than in the Fusion cushion or in the J2 cushion. So that pelvis is more free to move around. But that's what's giving it its more skin protection. Over the top, we would have similar cover options, an air exchange, a low shear, or an incontinent cover protection. Don't forget about the J2 Plus cushion. This is our bariatric version of the J2. It'll have a, sorry, this is still in Imperial, but 650-pound weight limit. And this is for a client that you have significant pressure issues, maybe skin on skin, sort of heat maceration issues. And so you want to have a cushion that can help them, but keep them mobile. Utilizes the same technology where we have that polyurethane closed cell foam base, fluid in the rear. This one has about 2 inches of immersion if you use the fluid bladder. You could also put slow memory foams into the back of the well. It comes with either option, either fluid or foams, and then a low shear cover over the top. We make this cushion with a little bit of an anterior wedge to the cushion. What we're trying to do is we know if we let the knees sit a little bit lower than the hips, that can influence the pelvis to try and come anterior. So we realize these guys have a tendency to put lots of weight in the back, have a bigger gluteal area back here, so that little bit of an anterior slope helps them with their posture, keeping a more upright, more neutral pelvic position. And again, with the higher weight capacities, the larger size availabilities. The last piece of the puzzle here, I've talked along the way, is the cover, because this is the contact area between the client and the cushion. And we've got lots of different approaches to try and manage that surface. Talked quite a bit about the cushions having an incontinent version. Basically what we'll do is we'll add a protectant material so that it keeps the urine from getting into the cushion, into the bits here. Realize that incontinent covers are probably more protective for the cushion versus the client, because this extra material here will diminish slightly, but still diminish the stretchability of the cover. Okay, so be aware that that incontinent takes away a little bit of the stretch, takes away a little bit of the air exchange. Probably the best cushion cover in terms of skin protection is our low shear and our X-Static cover. Our Fusion, our Union, and our Ion are all using this type of cushion cover. So it has the low shear top, but then embedded has antimicrobial silver fibers so that we don't let bacteria bind and get stinky and create bacterial problems. It's still nice and stretchy so that they can sink into the material that's below it. We would also have one other version of the cover, which is the microclimatic, and that has more of an air exchange material on the top, which draws moisture and draws moisture away from the client and allows air to flow. We saw that cushion cover with the J Light cushion. Along the way, we also looked at the inner covers. This is being utilized by the Ion and the Union. Because we're needing to sink into the material underneath, these inner covers have the stretchability, 6-way stretch, so that they can sink into the foam underneath. But they do a nice job of protecting the material underneath so that you can be confident that the cushion is going to be durable. So that's the material that we're using in the foam Ion and Union cushions. Don't forget that we have a whole portfolio of J Your Way adaptations. This brochure will be on the website as well if you ever wanted to know how deep the leg trough can be, how much fluid, obliquity, overflow you can do in particular cushions. Here's some examples of J Your Way modifications we've done along the way. This is a big wedge to a J Fusion. The color side bands we saw with the zip, camo. And don't forget all those J3 backs can come with painted shells so they can match their frame color. But their guide here has a whole list with pictures of well modifications that you can do, fluid modifications, base modifications. Very active in making modifications to suit the J cushion to your client. Appreciate you attending our steps and our webinars. Please fill out the survey that will soon be on its way to you. We'd love to have your feedback. We want to know how we can make these better and improve each and every webinar that we provide. We'll also give you links to the resources I was talking about on the Education in Motion website, the measurement guide, assessment strategies. We also have updated and are soon to be able to print our new J posters. Lots of you would be familiar with the J shapes, angles, seating postures that we've had for lots and lots of years. Well, we've updated those. We're getting them printed. We'd love to send them to you. So please send back the survey, give us your information, and we'll see you next time. Thanks very much.